Welcome to In Focus on this Sunday. Today we're turning our attention to rising healthcare costs and access to care. I'm Bree Driscoll. And joining us on this Sunday is State Senator Patty Lewis. She tells us just how she's using legislation to improve the healthcare system. Plus, Missouri Hospital Association President and CEO John Doolittle discusses challenges healthcare employees are facing. And later, Jefferson College President Dr. Dina McCaffrey explains the workforce pipeline and access to care. Let's begin today's conversation with my Spectrum News colleague, Robert Guadarrama, who speaks with State Senator Patty Lewis. Robert.
Thanks, Bree. We have State Senator Patty Lewis joining us now. Thanks for joining us today.
Thank you. Thanks for having me.
Sure. I'd like to start with the Family, Seniors, and Health Committee because you're a member and an active sponsor of many pieces of health-related legislation. Can you tell us about your work, and are there any recent developments you can fill us in on?
Yeah, sure. It's an honor to serve on that committee. I think a recent development this year is that I am the first Senate nurse to serve in the Senate in the history of our state. So that was pretty exciting to be the first nurse. However, I do think it's very long overdue. This year, many priorities of my constituents and priorities for Missourians, we were able to get across the finish line regarding healthcare, including protecting telehealth services for many folks, including audio only and audio visual. And this is needed. Not everybody has reliable broadband services, especially in rural communities, and our seniors sometimes have difficulty navigating the virtual aspect of telehealth. So protecting telehealth, especially audio only and audio visual, was signed into law this past year. We also were able to pass a bipartisan women's health bill, which includes multiple provisions that I started working on when I was in the House, including additional testing for pregnant women, increased access to contraception, updates to expedited partner therapy, ensuring that victims of sexual assault get transferred to the appropriate level of care. And also another provision that was signed into law was the sales tax exemption for feminine hygiene products and diapers.
So a lot there, long list. You've been pretty busy. Let's go and lean into that. Let's explore more about your experience as a former ICU trauma nurse, because that is really extremely valuable perspective that you have. How does your experience in that profession help you better serve your district today?
Well, I think it puts me in a very unique position. Like I said, I'm the first nurse to serve in the Senate and the only one. We've got a nurse serving in the House currently right now. But when we talk about affordability, rising prescription drug prices, these aren't just stories. These are people that I took care of. I had many patients who were admitted to the hospital who were struggling with paying rent, paying for groceries versus paying for their prescription medication. I recall one particular patient who was a diabetic, who was a single mom working, who, decided to make the decision to pay groceries for her children versus paying for her insulin, which landed her in the hospital in the ICU, missing work, getting further and further behind financially. So, these aren't just headlines to me. These are real people that I took care of that I think about every single day in Jefferson City. And, one of the main reasons I ran for office was to increase access to healthcare and decrease barriers. Because, I just think about the patients I took care of. And when we talk about the trauma experiences that I worked in the ICU, gun violence, I took care of several patients who were victims of gun violence. And oftentimes we couldn't save them all. And I was left comforting loved ones in the wake of a tragedy.
Right, you mentioned there how, affordable health care and access is near and dear to your heart. We've reported about rising health care costs. What is the Appropriations Committee doing to address concerns related to health care?
Well, right now we're not in session, and so we're doing nothing. We were called to a special session a month ago to address gerrymandered maps and make it virtually impossible to pass citizen-led initiative petition. So the supermajority Republicans in Jefferson City, this doesn't appear to be a priority right now. I hope when we reconvene in January that we have a supplemental bill ready to go to pay for essential healthcare obligations.
Before I let you go, October is National Breast Cancer Awareness Month, and November is National Diabetes Month. What is the Senate doing to ensure health, equity, and access to services and resources for all of your residents?
Yeah, so I think just like I said before, I think we could do more. I think that calling us back to Jefferson City for a special session to gerrymander the maps at the will of the president doesn't do anything for our health care for Missouri citizens. We need to be doing more. We need to focus on our constituents and increasing access to health care and removing barriers.
Sure. Any strategies you can think of to address what's going on right now at the federal level?
Well, I support the Democrats on the national level who are very concerned about healthcare, rising healthcare costs, the unprecedented decrease and defunding in Medicaid. This will hurt Missourians, hurt many folks across the country, and we need to be ready to address it when we go back in session. Right now, I think we need to look at what healthcare looks like in the state of Missouri, and it isn't great. The maternal mortality rate and infant mortality rate in our state is equivalent to some third world countries. We have rural hospitals that have closed over the past decade, and several hospitals are already at risk of closure, and that's before these Medicaid cuts have gone into effect.
You have your work cut out for you. State Senator Patty Lewis, thank you so much for your time.
Thank you.
Welcome back to In Focus as we discuss healthcare. And joining us now is John Doolittle, President and CEO of Missouri Hospital Association. Thank you so much for being with us. First off, as you know, we're discussing access to care on this show. What are you seeing on the ground as a top issue for those seeking care on a daily basis?
Well, first of all, thanks for the opportunity. What we're seeing on the ground is what we've seen on the ground for a long time. People need health care, and they come to Missouri's hospitals and health systems at times of need, and we do the best we can to wrap our arms around them. As far as access changes these days, it's a busy time. It's a busy time for most of our members. They talk about a lot of congestion in emergency departments. They talk about a lot of people who are coming to us for care, perhaps after it would have been ideal for them to access primary care, access preventive care. But the wonderful people who work in Missouri's hospitals are always there to take care of them and to reassure them.
And what are some of the challenges currently facing the healthcare workers?
Healthcare workers, they're the best. And my entire career, I've had a one-line job description. I take care of people who take care of people. We all, as healthcare leaders, want to do exactly that. We see what they do. What's been most frustrating for a lot of healthcare leaders in recent months and years has been an increase in violence in healthcare work settings. And it's something that any servant leader worries about day and night, wants to make sure that we have proper protections, proper culture, and that nice mix of people coming to a healing environment, people coming into a place where they feel safe. But we have to do the best we can to turn the temperature down on conflict in our care settings. And I know every healthcare leader is very interested in leading conversations and doing the best they can to support their caregivers in environments that sometimes can feel a little scary.
Why do you think that is? Is it just that these are stressful situations?
There always are stressful situations, but we have seen, whether it was born of the COVID pandemic or other factors, we have seen a rise in sort of irritability and acting out against healthcare workers. And Missouri has legal protections in place that elevate the level of crimes. We want to have that deterrent function. We also don't want people to feel like they're walking into a scary place. But healthcare access includes the ability to be welcoming, the ability to have people in proper settings, the ability to take care of them quickly. And hospitals and health systems work very hard to connect with people where they are and get them to those right settings to try and lower those levels of frustration and provide high value care.
Now, hospital advocacy is a top priority for you. How are you combating rising health costs?
Yeah, rising health costs are a concern for everyone. And one of the things that we note is that, again, in our system, it can be a little hard to navigate. And you see hospitals and health systems really working hard to connect with people at home, to connect with people in clinical settings and community settings, and try and get them routed to the right place for the most efficient care, the care that can keep them from getting sick. And that's an incredibly important part. The other thing that, from an advocacy standpoint, is a top priority for us is getting friction out of the system from an administrative standpoint. We spend almost $30 billion a year in this country pushing paper back and forth in regard to a thing called prior authorization. When people know that they need care, providers know that they need care, there are appropriate mechanisms to make sure that people don't get care that they shouldn't and that providers don't provide care that they shouldn't. But what we've seen is an incredible rise in denials of care and delays in prior authorization. And from an advocacy standpoint, we're working to try and get to a more rational system. It feels like the dial has been turned up pretty high and people are frustrated, back to my prior point, and there's a lot of expense and delay in information flowing back and forth when really reasonable people could agree and reasonable providers have proven that the care that they're ordering and requesting for their patients is reasonable, appropriate, and can be done at a low cost.
Yeah, that's something I'm seeing myself as well. What about those who are scared to get care because of high costs?
Yeah, what you see, of course, in our system of people think about access to care, they often think about insurance coverage. And we have seen in the state of Missouri in recent years, growth in the Medicaid rolls. Those now have come back down as we exited the pandemic and we started to evaluate whether or not people should be on Medicaid if they don't have access to private insurance or Medicare. Hospitals, health systems, other providers work hard to make sure that people understand the insurance coverage that they're entitled to. But as you know, hospitals and health systems take care of everyone regardless of their ability to pay. And we work hard to reassure people to come get their care. We don't want to provide a lot of primary care in emergency departments. We want to get people into proper care settings, and hospitals and health systems do that themselves and work with partners so that people can feel that the health system is working together on their behalf.
Yeah, and a lot of preventative care as well will keep them out of those emergency situations, correct?
Absolutely. That is our desire. The health system tries and we know it can be intimidating. It can be a little scary. But what we want is to have that trusted relationship, to truly be that health home for mom, for dad, for grandma, for the decision makers and families. So my advice to people who think about how they want to manage their own care is form that trusted relationship, spend time on the front end taking care of yourself, and then let the system work for you.
All right. John Doolittle, President and CEO of Missouri Hospital Association, thank you for your time.
It was my pleasure.
Back now with In Focus Missouri, as we are focusing on the state's healthcare system. It ranks the 4th worst nationwide in terms of primary care provider shortages, according to the Kaiser Family Foundation. Joining us now to discuss how to address this issue is Dr. Dina McCaffrey, president at Jefferson College. Thank you so much for being with us today.
Thank you for the invitation.
Dr. McCaffrey, as the leader of an educational institution that offers programs in healthcare, what needs to be done to address these shortages we are seeing?
Well, what we do is try to partner with our local healthcare facilities in addressing their needs and to really be innovative in our approaches in making sure that we are graduating and training the best students possible to work in the fields.
Now, you're the first woman to be president of the college. How has your past experience helped you to tackle this role while opening the doors for future professionals?
Well, I really have worked on relationships and building relationships throughout the community. For example, Mercy Jefferson Hospital, which is located here in Jefferson County, and that's the region we serve. I have connected with different individuals there. I've been fortunate enough to serve on their board for the past 6 years and am getting ready to start serving on the board of the Mercy East communities, which includes the St. Louis region all the way down to the Boot Heel in Missouri. And throughout those, by serving on those boards and having relationships with different individuals, we have been able to commit to being innovative in how we address healthcare needs. For example, on our campus here, we have about 500 high school students in a variety of trades and career training programs. We're the local career center for the 12 high schools in Jefferson County. And we actually work to create pathways for students. They start as a junior in high school getting their CNA, and then their senior year, they can get their patient care technician. And we have a pathway where students can be hired by Mercy Jefferson as a patient care tech as they take their prereqs and enroll in our nursing program, where they become an LPN and then an RN. And so our partners in the medical field will support their education, employing them, but also help them to reach their bachelor's degree or whatever their next goal is after they graduate with their associates. So we are doing apprenticeship and pre-apprenticeship type programs in healthcare fields.
And tell us how you're supporting your students to get the resources they need to succeed.
There's a lot of different ways we support students. We make sure we have state-of-the-art labs right here on our campus so that students can get those healthcare training skills and learn about bedside manner and how they work with patients. And so we have a lot of equipment, a lot of simulation equipment to help with that. We also have, in addition to nursing, we have a radiologic technology program. So those students have state-of-the-art equipment also that they get to practice on before they go out into the field. And all of our healthcare programs include a significant number of clinical hours. So they are working side by side by people already in the field to ensure that they have those skills and are work ready when they graduate.
And in your opinion, are enough students getting access to the services they need before they enter into this field?
Yeah, it's tough. It's really hard. And so scholarships are important. We have a student success center. So if they're taking anatomy and physiology, we have biology faculty who teach in those fields that serve as tutors to support them in that prerequisite coursework. Our students all have advisors dedicated to them so that whether they're in their pathway working directly with their faculty advisor or prior to that when they're taking their prerequisite courses, that they have someone they can turn to. And then we have a whole team that assists, whether it's you need to talk to a counselor about something personal going on in your life. If you're a lower income student, which we serve several lower income individuals, we have what we call a Viking Vault on campus, which is a food pantry. So we just try to connect students where they are with resources so that in the classroom they can focus on being a student and focus on their program. And then we have support services to help with other things that might be going on in their lives.
Yeah, sounds like there's a lot of support in place for students. Well, they're students, but what does Jefferson offer to help students when they're finding jobs after school?
Sure, we have a workforce and employment office, and they specifically work with students on their job search, from everything to writing resumes, to applying for jobs, and also with employers to connect them with our students. We do job fairs, specifically healthcare job fairs. I was just speaking yesterday with our rad tech program faculty, and she said that they have grown so much and their students are, so many employers want to hire their students because there's such a need for radiologic technologists that they are having their own job fair this year. So we really work to connect and partner any way we can with the local workforce. And it's important to us that to make sure that we are graduating those individuals who are prepared. These programs always have more applicants than spaces in them, and that's not necessarily because we limit the spaces, except that we work with like the Missouri State Board of Nursing, and they allow each institution, whether you're a 2-year community college like us or a 4-year institution, they tell you how many spaces you can have. I mean, you request them and they let you know. So we've been able to expand our nursing program that way and our rad tech program. And we have accrediting bodies with those, in addition to the Missouri State Board of Nursing, that also say how many students you can have per clinical site so that you're not overloading those clinicals and students aren't getting all the skills they need.
All right, Dr. Dina McCaffrey, President, Jefferson College, appreciate your time today.
Thank you.
Thanks so much for watching this special healthcare edition of In Focus. I'm Bree Driscoll. We appreciate you spending your Sunday with us.
Thanks for watching our YouTube channel. To keep up with important issues impacting our communities and hear more conversations with the people who are shaping the future, subscribe to our channel. You can also download our app or find Spectrum News on your TV for balanced, in-depth political coverage and more.